Adrenal fatigue is one of those terms that gets immediately dismissed in conventional offices while completely overused in many holistic spaces. What almost never happens is somebody actually reading objective data and finding your symptom pattern and what it's telling you. I'm Dr. Kenny Middlestat, an IFM certified functional medicine practitioner, and this is exactly the kind of pattern that I walk through with patients who have been symptomatic or dismissed for years and still don't have a complete explanation. Today, I'm going to walk you through the most common signs of adrenal fatigue, or more appropriately called HPA axis dysfunction, what each one reveals about your stress chemistry, and why treating them as separate problems is exactly why they keep coming back. So let's set the frame around adrenal fatigue. Most people who come in with what we call adrenal fatigue are high performers, and they describe the same two experiences. They can't get up and get going in the morning as predictably, no matter how long they've slept. And then somewhere around 10, 11, or even 2 o'clock at night, they're suddenly wide awake and can't fall back to sleep. They've usually been told that this is anxiety, or to improve their sleep hygiene, or that it's just stress. But here's what's actually happening underneath the surface. Cortisol is your body's primary stress hormone, and it's also your alertness hormone. And it's supposed to follow a specific arc through the day. It peaks within the first 30 minutes to 45 minutes when you wake up in the mornings. And that morning surge is what your brain uses to shift into daytime mode in your nervous system, in your hormones, and beyond. It also helps to mobilize your energy and even regulate your immune responses. Then it tapers off through the rest of the day and reaches its lowest point at night, which is what allows you to actually sleep. A pattern that I see quite commonly in especially complex fatigue cases, or where you're trying to heal, but it's not happening as predictably, that arc is actually inverted. Many of my patients who experience major fatigue walls or high stress throughout the day are also often surprised to find when they are actually operating with low cortisol. So this exhaustion, this stress, and what it does further downstream to the process of healing is not really a mystery when we have this piece of the puzzle. We recognize the signaling problem and the resilience issue underneath. When you don't have the cortisol and the rest of the hormone and nervous system support that was supposed to mobilize you and give you that floor to stand on, and then at 10 p.m. it inverts and suddenly you have a spike of cortisol that should have been declining for hours. That's what keeps you awake when you're already exhausted, that tired and wired conundrum. I call this the cortisol inversion pattern, and it's not a disease or a diagnosable process. It's a rhythm that has been running out of phase, oftentimes for many years. And when you start to see it this way, the symptoms that we're going to talk about that appear completely unrelated start to look like the same pattern, just expressed differently. And that's exactly what functional medicine is all about. The standard adrenal fatigue conversation, especially in the conventional paradigm, focuses on just the adrenal glands themselves. These are the small glands that sit on top of your kidneys and they produce cortisol, amongst other things. And that conversation usually goes one of two ways. You may have experienced this. Either a conventional doctor tells you that there's nothing wrong because your cortisol on a single morning blood sample is within the normal range. Or someone on the wellness side tells you that your adrenals are getting exhausted and you need to support them without any objective data, and they just hand you the adaptogens. Both of those explanations stop too early in the line of questioning. The real question goes far beyond whether or not your adrenal glands are broken. It's whether or not their subtle signaling rhythms are intact and supporting the rest of your chemistry. There's a signaling loop that takes place between your brain and your adrenal glands. This is what we call the HPA axis, and it operates on a constant feedback system. You can think of it as a thermostat where the hypothalamus, which is part of your brain, detects what your body needs. And then it signals to the pituitary gland, which is a neighboring master gland, and it's at the base of the brain, that then signals to the adrenal glands to produce cortisol and other hormones. Cortisol feeds back to the brain to say that there's enough that's being produced, and that loop typically closes, and the whole system resets to do it again and again. But when that loop runs on chronic demand, sustained psychological stress, inflammatory stress, sleep stress, metabolic stress, you can see stress as a theme here, that feedback sensitivity changes. Your brain adrenal thermostat stops reading the room accurately, and instead of a clean arc from high to low stress chemistry that supports you, you get a flattened or inverted rhythm. The most common conventional way to assess cortisol is a single morning blood draw. It can look completely normal even when the pattern is significantly disrupted underneath because it's one data point on a curve that's supposed to move throughout the day. Research that is comparing clinical burnout cases to non-clinical burnout cases and healthy controls found that both burnout groups showed a significantly lower cortisol awakening response. This is the morning surge that gets us up in the morning compared to healthy controls. And what this means in practice is that the morning low or even the afternoon dips that many people feel are objective. It shows up as a measurable difference in cortisol output at different times of the day. So if you've had a cortisol test before and been told that it's normal and it was a blood lab, this is likely the test that was missing. Most commonly in the functional space, we use a salivary cortisol test, and we measure 4 to 6 points. I like to capture the 6 throughout the day to get the most accurate read on the way that your brain and your adrenals are communicating. If you're finding this video useful, go ahead and give it a like. And I've also put together a free research summary that looks at the studies that I used in this video in more detail. It also gives some key takeaways. If you're one who likes to dive into the citations, that's for you. So check it out in the description and the pinned comment below. Download the free research summary below. So your cortisol rhythm is disrupted. What does that actually cause symptoms-wise downstream? Let's talk about how all of these present, and you'll see how many connect. When cortisol is particularly low in the morning, your brain doesn't get the signal to shift into daytime mode. This affects hunger and blood sugar, because cortisol normally triggers the liver to release glucose into the bloodstream to fuel the morning, especially in a fasting state. Without that trigger, many people feel shaky, foggy, or even anxious within that first hour or two of waking. Some people need to eat immediately to feel functional. Others have no appetite at all, and that's worth looking into. That blood sugar instability piece is not a coincidence. This one surprises a lot of people. Cortisol and insulin, the hormone that manages glucose by shoving it into your cells, that's secreted by the pancreas, have a direct relationship. When cortisol is chronically dysregulated, the way your body manages glucose becomes less stable because of how it impacts insulin. Your hormones are connected like a little spiderweb network. A review examined how HPA axis activity and insulin interact, and it found that cortisol directly affects how the pancreas releases insulin and how cells respond to it. So it comes from both angles, or processing that can show up as energy crashes. Dysregulation of this blood adrenal axis is associated with changes in the way your body handles blood sugar. And I've got to say, I've seen cases of patients where it's less about what they're eating, the high sugary foods, and it's more about the high stress chemistry that's driving blood sugar instability, even to the point of prediabetes and diabetes. The symptoms that come up with this particular pattern of adrenal fatigue shows up as energy crashes, sugar cravings, and poor blood sugar control based on your labs. And this occurs even if you don't have prediabetes or diabetes, which is another way of saying that 3 p.m. crash that you may experience that you reach for the sugar or the caffeine to help fix may be a cortisol problem. Here's a pattern that comes up regularly in practice as well. Patients will say that they do okay if they eat perfectly, right? Small meals, protein at every meal, no gaps in between. But the moment they skip a meal, or get stressed or sleep poorly, they have a crash. That narrow margin is a pattern because when we look at the HPA axis and blood sugar conversation as one of the layers that contributes to your resilience at large, this is your body trying to compensate for a cortisol rhythm that isn't doing the job of stabilizing blood sugar automatically the way that it's supposed to. I'm genuinely curious if you've been managing energy crashes or blood sugar instability problems like this. What have you been told is causing it? And has cortisol ever been part of that conversation? Drop it in the comments below. I read every one, and it's great to see other people's stories come out in these conversations. Now, we've covered the sugar basis, but let's talk about something that doesn't get discussed in many adrenal fatigue conversations, and that is salt cravings. If you find yourself reaching for the potato chips or the pretzels or similar, this part is for you. Most people know that cortisol is produced in the adrenal glands. Fewer people know that the adrenal glands also produce a hormone called aldosterone. This is a hormone in a category called a mineralocorticoid hormone, which is the category of hormones that regulates sodium and other electrolyte and fluid balance. Aldosterone's primary job is to tell the kidneys to hold on to both sodium and water. Without enough aldosterone being present, sodium leaves the body in the urine in higher amounts. When aldosterone is underperforming in the context of HPA axis stress or adrenal fatigue, not absence as in true medical adrenal insufficiency, so that's another conversation on its own, but rather running at a lower capacity, the body begins to lose sodium faster than it should at a functional level. And the symptom that results is that craving for salty foods that most people just assume is a bad habit, black and white. Research on mineralocorticoid deficiency, like aldosterone, documents a specific symptom pattern: salt craving, muscle weakness and fatigue, postural dizziness, and low blood pressure in many individuals. These are the same symptoms that show up in functional subclinical presentations of adrenal fatigue. So your body may not be craving salt because it's quote unquote addicted to it. It's signaling that it needs more sodium to maintain fluid balance. But higher up, it's an HPA axis and cortisol dysregulation issue. So stay with me here because this connects to something that matters for testing if you're going to go that route. If you're one who regularly gets up from a chair or from a lying down position and feels momentarily dizzy or lightheaded, that isn't just simply low blood pressure. There's many underlying causes, but it may also be an aldosterone signaling problem. Another category of symptoms that shows up along adrenal fatigue live in the immune system. Cortisol also plays a major role in anti-inflammatory and immune signaling throughout the body. When it follows a healthy rhythm, high in the morning, gradually lower throughout the day, it does a measured and regulated job of keeping inflammation responses in check. When that rhythm is disrupted and cortisol especially is chronically low or low on average throughout the day, the immune system loses a regulation set point. What this can look like is getting sick more often, having more seasonal allergy experiences, taking longer to recover when you are sick, or even food reactions to things that you used to tolerate well. These aren't random co-occurrences. These are signals of the same underlying potential in the HPA axis. Insomnia and waking up wired is another very common symptom. In a healthy rhythm, again, we're supposed to have our lowest cortisol at night, which prepares us for sleep. Melatonin kicks in and other hormones that help to coordinate healthy, relaxed, deep sleep. But if evening cortisol is elevated, or if it spikes in the middle of the night, which is a common pattern as well, this is part of that cortisol inversion pattern. And this one surprises people, especially when you're waking up between the hours of about 1 to 4 a.m., unable to fall back asleep. Look at blood sugar control once again, because when we're processing that last meal or dessert of the day, by that time, insulin has likely exerted most of its effects. And when you get a blood sugar dip on the other side, cortisol comes in to essentially save the day and keep your blood sugar within its normal functional range. That cortisol peak, however, is also what wakes people up in the middle of the night and sometimes makes it very difficult to go back to sleep. So you can see these symptoms touch different areas of the body that are often worked up separately in many conventional conversations. They don't require necessarily 14 different solutions, though you may be matched a pill for every ill. The morning low energy, the blood sugar instability, the salt cravings, even the low immune function and the resultant symptoms. These are all things that can trace back to the same disrupted cortisol signaling arc. So what does a good investigation around cortisol signaling actually look like? This is the single most important shift from running a static single sample blood test for cortisol into a 4 to 6 point cortisol test that I measured that shows us your actual rhythms throughout the day. And many of my patients, when they see their cortisol rhythms tests, are completely shocked by the results because it's almost the exact opposite of what they had expected. High cortisol or low cortisol, depending on what their symptoms are. We also get deep insight into DHEA. This is another hormone that your body produces alongside cortisol, and I consider it's another piece of the picture when it comes to establishing resilience, that floor of energy and immune function and inflammation regulation. DHEA plays a huge role in managing stress chemistry as well. So if your healing journey and investigation have stalled and you're not sure what's been missed, and you're in one of the states that I practice in, the next step is to watch the free training that's in the description below to help you prepare for booking a health mystery map call. And the idea is that it helps give you a clearer picture of whether what I do fits where you are in your healing journey. This HPA axis conversation is one that deserves more spotlight in our chronic healing situations, and I believe that firmly. And if this cortisol inversion pattern describes what you've been living with or just creates a new light bulb for you, that tired all day, wired all night, maybe blood sugar instability or immune system regulation issues, the question that actually changes the picture for many of my patients isn't simply what supplement should I take for this symptom. It's what's driving this rhythm disruption to begin with. And that's the answer that doesn't come from a single blood draw. And it's the one that opens up a completely different investigation many of the times. So what's upstream of your disrupted rhythm? That's exactly the line of questioning of true root cause functional healing. And that's exactly what this video here goes over next. So check it out. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next one.